Now the Brandt-Andrews method, which is the controlled contraction, is considered to be the correct method to conduct the delivery in the third stage. Third stage of the labor is called expectant management, active management. For the expulsion of the placenta, expectant versus active management. Excessive traction should not be applied. It is a controlled contraction. Brandt-Andrews method is considered to be the best way. Epidermitis can be caused by the chlamydia. Trachomatis is the most common organism in the sexually active individuals, is what need to be remembered. Now you all agree with me that tractional, rhegmatogenous, what is the third type? Huh? Exudative, very good, very good. There are 5-6 causes for each of them. So you should definitely remember, one question is going to come. So the main cause of a rhegmatogenous retinal detachment will be a retinal tear with a retinovitrial pathology and any prior intraocular surgery, and a axial myopia, CMV retinitis in HIV, ocular toxoplasmosis, any of them can lead to development of rhegmatogenous retinal detachment. Then what is an X-linked inheritance? The Alport syndrome, type 4 collagen formation is defective, which is basically the gene located on the X chromosome. Von Koyanagi-Harada syndrome, what do you find? Bilateral rhidocyclitis, posterior uveitis, CSF pleocytosis with vitiligo, with alopecia, with poliosis. That's what you see, a combination, von Koyanagi-Harada syndrome. This is a very practical question, whether you attended housemanship or not in surgery posting. 6 hours is, how many would like? Huh? Hare, are the recommendations are changing or what? How many say 6 hours? Agree with 6 hours. At least I agree with 6 hours, but I don't know. It was long time that I did a surgery posting. But it's a common protocol to have 6 hours, but since a significant of you are emphatically saying like a parliamentarian, whether right or wrong, so we will counter check that. Now, but 6 hours is our current answer. Now in early pregnancy, doubling occurs of HCG every 48 hours, you expect the doubling. Ghrelin is the one which will make us to feel hungry, so it is the one which stimulates the hunger. PGF2 alpha is the one which acts on myometrium. How many answered as ovary? Anybody? Imagination didn't go that far, but I will give a justification why it can be ovary. We use prostaglandin F2 alpha because it acts on the corpus luteum. It will cause a luteolysis, and that's how it will induce a early abortion. So corpus luteum is located in ovary, by that I can argue that it can be ovary also. So, but definitely it is in myometrium, there is no doubt on that. Now what is the normal plasma osmolality? 285 to 295, in fact 275 to 295 is considered to be normal. So what is hematospermia? Finding the blood in the semen is called as hematospermia. It can be first indication of a urological disorder in some people. Any prostatic pathology, seminal vesicle pathology, or a pathology of the urethra, any of them can be responsible. Urethritis is a very commonly recognized underlying cause of the hematospermia, is what you should remember. In hepatitis B we use lamivudine, which is one of the drugs which is also used as an anti-HIV medication. Veal Felix is typically used in rickettsia. What is the minimum blood alcohol level? Policemen won't catch you at the end of the college party if you are driving and caught. So it is 30 mg%. Anything more than that, according to the section 185 of the Indian Motor Vehicle Act of Vehicle Act was proposed when? Actually it is proposed somewhere in 80s. So before 80s you can drink and drive. Very less number of chances of being caught according to law. So what is the difference is, US is all controlled by law. There is no religion, no parties, no emotions, nothing. Law is the one which guides father, mother, husband, wife, child, and student, teacher, every relationship. Whereas in India we are all having different sort of emotional blackmailing available, no law in Indian scenario. So the tear film has got three important components. There is a oil, water and mucin. Oil is produced by meibomian, water by the lacrimal, mucin is by goblet cells. So they are the three components of the tear film is what need to be remembered. Freshwater swimming can lead to development of leptospirosis. Waddling gait with the proximal muscle weakness involving the gluteals can lead to development of can be seen in muscular dystrophy. What is Heidi's syndrome, doctor? Those who have aortic valve stenosis, they can have a colonic angiodysplasia as a combination which can lead to GI bleeding. Already there is a poor AV stenosis. On the top of it there is a development of GI bleeding due to colonic dysplasia. It is called Heidi's syndrome. In ulcerative colitis, if there is a toxic megacolon suspected, never do colonoscopy because it will promote the perforation of the colon. So it stands as a contraindication for the colonoscopy, as all of you know very well. Now if there is a foreign body aspiration clinically suspected by you, when will you suspect it in a child? She is regularly getting infections, respiratory infections. One of the important causes you should suspect is a possible foreign body aspiration. So even if foreign body is aspired, if you take an X-ray it may be normal. So it is not always abnormal, and a normal chest X-ray does not rule out your clinical suspicion. So that is the rule. Now what is the difference in presentation, radiological presentation X-ray, if at all positive finding is there? It is the hyperinflated lungs in case of children, most common radiological picture. Atelectasis of the lungs is the most common picture in case of adults with a foreign body aspiration, like a denture in an elderly man got aspirated. Then that particular lobe of the right lower or whatever will undergo atelectasis in case of the adults is what you have to remember. The Waardenburg syndrome, what does it contain? It contains heterochromia, a white hair lock which is called as poliosis, and white set eyes called as hypertelorism, and a hearing loss of which kind? Conductive or sensory, doctor? Sensory neural deafness is what you come across in case of the Waardenburg syndrome, is what you should be very sure. So remember, doctor, two questions commonly come. Syndromic causes of sensory neural and conductive deafness. Sensory neural deafness ka syndromic causes. You should remember 5-6 syndromes leading to sensory neural deafness, favorite question of examiner. Yellow fever require a international health regulation vaccine intake. Putamen is the most common location for the intracranial hemorrhage in hypertension, and it is the parathyroid, pituitary, pancreas, the three centrally located organs are the ones which are involved in the MEN1 syndrome, which you should be very sure about. N-coupe de Sabare, what does it mean? It is typically seen in the case of the scleroderma. What does it actually mean? It is that linear scleroderma which affects the forehead. It appears like an indented vertical colorless line of the skin on the forehead, called as N-coupe de Sabare is what need to be remembered. Constitutional is the most common cause of the short stature. Gopalan's burning foot syndrome, pyridoxine deficiency, you should be quite sure. Then emifostin is the one which will use to prevent cisplatin induced renal toxicity, is a very well known question. Missing cases identification is a part of sentinel surveillance. IgA will provide the mucosal immunity, and ABO incompatibility is a immune hydrops, not non-immune hydrops, whereas thalassemia, chromosomal anomalies, and parvovirus B19, they are all examples of non-immune hydrops. Then a freshly collected blood in CPD solution bag will have a pH of around 7.1. You feel very awkward situation to answer such questions which look very nearer to you, you can't catch them, kind of sour grapes and fox story is kind of situations, but they won't really cost. For everybody it is luck. Who will go with an exam with an preparation, is it 7.1 or 2, unless he is working as a blood bank or medical officer without getting seat for 3-4 years. Even then he has very little chance of doing it. What are the facts about autosomal recessive and autosomal dominant disorder? Autosomal dominant will multiple generations get affected. Grandpa had Huntington chorea, son had it, grandson had it, but it is becoming more severe as the generations is coming down. So vertical transmission is what you see. Because it is autosomal, male and females are equally affected. And from male to male transmission is seen because it is not X-linked. And each child of an affected individual, if you see, has 50% chance of carrying that gene. And even if one chromosome from one father comes also, if it is autosomal dominant, he can get affected. So there is a chance of 50% chance of being affected even if one of the parents is an affected parent with an autosomal dominant disorder. Unaffected individuals do pass on the gene to the others, and every affected child has an affected parent invariably is what need to be remembered. The non-penetrance and variable expressivity, they are all the features of autosomal dominant. Then horizontal pattern, only single generation get affected if it is autosomal recessive. Easy to remember because autosomal recessives will be mortal conditions. They lead to death right in the childhood. So he won't grow to become adult to marry and become pregnant or make pregnancy and then procreate the next generation children. Easy way to remember. So horizontal transmission within one generation. Why within one generation? Because all the kids are born to the parents who have an abnormal gene, but as children they already died, so less chances that they give it over to the next generation. So horizontal transmission is seen. Then children of the affected individuals are obligate carriers. Consanguinity has a lot of role, especially in autosomal recessive disorders, not autosomal dominant is what need to be remembered. So I leave all this for a quick literature for you. Tyrosine hydroxylase. So if you tell me, doctor, it's a perfectly synchronized paper, at least 70% of paper. Because if you see our first 500 topics in pathology, I remember the Sunday where we discussed pathology, almost a couple of hours of our time we invested on discussing autosomal dominant, different genetic patterns, how to recognize based on pedigree, based on the past 15 years all India AIMS PGI question bank, our Sunday day long discussions. So it is always rewarding if you read those frequently asked topics frequently. Now rate limiting step would be tyrosine hydroxylase deficiency in catecholamine synthesis. Then it is a DNA content which is the most important indicator, but if you take stage versus grade, which is more important for prognosis, doctor? Stage, lymph node status is the most important predictor of because stage being not given, the next best would be DNA content of the tumor. What is your answer? After stage you like to place grade. Stage and DNA ploidy, they have more or less an equal status. So considering that, we consider DNA content, but any unique monogram you have to say grade is next best, not DNA. DNA falls between the two. Then smokestack appearance, as the smoke is coming out, kind of a picture you see with central serous chorioretinopathy, classical angiographic finding. Auricular branch of the vagus is basically called as the Alderman's nerve. For bronchiectasis, it is the HRCT which can enable you to know is it cylindrical, what type it is, extent of it, any other complications of it, everything you can delineate by doing high resolution CD scan. Thickened gastric folds is a feature of the Linitis plastica. Etomidate is considered to be one of the cardiostable among the drugs which had been given. Ketamine lead to severe hypertension. Propofol sometimes can lead to hypotension. So considering all the three, then out of all it is a valine which migrates fastest on the paper chromatography. From here these are all AIMS questions. Then allopurinol is used for the free radical destruction in University of the Winkowskin organ preservation solution to prevent free radical destruction of the transplanted organ. Then ideal contraceptive for newly married couple would be the OCP. Then WHO category of the 4. So each of the categories we should be sure, based on that you can just check. Esophageal candidiasis is placed under the clinical stage 4. but what had been given was oral candidiasis, which is not a part of the WHO category 4. It is the esophageal candidiasis which is included under the category 4. That is the idea of the question. Iron absorption is affected by celiac disease or any small intestinal pathology, but not by the ulcerative colitis, which is generally limited to colon, unlike Crohn's, which can creep anywhere. Then anxiety can be a presenting feature of the hyperthyroidism, not hypothyroidism. Hypothyroidism will lead to so much laziness, no time for anxiety. Then in case of recurrent deep vein thrombosis, what is the targeted INR as a prophylactic value? You should give sufficient warfarin such that the INR is maintained at 3.5 as a prophylaxis is the international guidelines. But for every given dose of acetrom or warfarin, will everybody will achieve the same INR? No. In some people, if 2 mg causes an INR of 3.5, in some people only 1 mg can cause it. So you should titrate the warfarin dosage such that you maintain 3.5 INR. That is the whole idea of preventing deep vein thrombosis. For the Legionnaires' disease, it is the azithromycin which is considered to be the drug of choice. For the allergic bronchopulmonary aspergillosis, it is allergic, not aspergilloma. So that is the reason prednisolone is considered to be the drug of choice. For the fungus ball, surgical resection is the drug of choice. And invasive aspergillosis, we use voriconazole, liposomal amphotericin B, etc., etc. For a disseminated invasive aspergillosis, that is a fundamental difference. So you should also know criteria of ABPA, doctor. One question definitely comes on that. Then in Clostridium tetani, what we see are terminal spores rather than subterminal spores, and because of the terminal spores, how does Clostridium tetani look like? It looks like a squash racket because of the terminal spore which is located at the end of the terminus. Now this is a good question. Inferior cerebellar peduncle, what does it contain? So what are the 3 cerebellar peduncles? Out of that, which is the major cerebellar peduncle? Middle. Brainstem is 3 floors. What are they? Midbrain, pons, medulla. Cerebellum is connected to these 3 parts of brainstem by throwing 3 ropes. Superior, middle, inferior cerebellar peduncle. Inferior cerebellar peduncle finally will go to the lowest one, that is towards the medulla. Now what does it contain? It contains the important fibers include spinocerebellar tract and axons from the inferior olivary nucleus, dorsal spinocerebellar tract, cuneo-cerebellar tract. They are the important components. So that's the reason pontocerebellar tract is not a part of inferior cerebellar peduncle. Ponto is probably related to middle cerebellar peduncle. That's what you should be quite sure on. Then bullseye lesions can be found like this. In case of the chloroquine toxicity, it is also found in cone dystrophies and Stargardt disease also. The bullseye lesions can be found. I leave all this literature for you to review because what is Stargardt's, etc. I mean you need to understand. Then kleptomania, taking away Hausergen's stethoscope by CMO. So finally CMO will have all the different Hausergen stethoscopes he had been working for the past 20 years will be there. But he can't use multiple stethoscopes, right? So his idea is not to sell stethoscopes, his idea is to not to use stethoscopes, but it is an impulse which makes him feel comfortable. So every time we go to the casualty, they used to say, be careful about that so and so XXXX CMO. If you are especially going with that freshly purchased Littmann stethoscope as a house surgeon, you should be sure. So that's all the story. But that guy used to even have all our Sister Mary's pins, hairpins. So many weird objects he had as a kleptomaniac finally. So it is only an impulse disorder is the whole idea. Then what does mycetoma foot basically indicate? It's that subcutaneous granulomatous inflammation which is called mycetoma foot. Then in a 10-day-old child, what is the most common cause of the meningitis? So the group B streptococcus is the most commonly identified organism in roughly 50%, followed by E. coli for another 20%, and Listeria monocytogenes is the third most common pathogen leading to the neonatal meningitis is what need to be remembered. Then what is the blood supply of the breast? It gets from the internal thoracic artery, from the lateral pectoral artery and posterior intercostal artery. They are all the various divisions which give the blood supply. And 75% of lymphatic drainage is into the ipsilateral axillary lymph nodes, whereas the 25% goes to parasternal and contralateral and abdominal group of lymph nodes. It is a DUB or anovulation. Okay. Now the most, no, it is puberty menorrhagia, right? Okay, I mean in the sense that menorrhagia is the one versus puberty, considering the two. Okay. The most common cardiac tumor in childhood would be the rhabdomyoma on any given day is the most common cardiac tumor, and apex of the lung is generally involved. In the case of the Klebsiella pneumonia affects mainly the upper lobes is what you have to remember.